Good day, students. You're welcome to my lesson. The theme of my lesson, disease and their treatment. Lesson objectives. Learners will be able to read with sport a limited range of topics. Answer the questions about disease and their treatment with topical vocabulary without sport. Write situations based on the text using the expressions and structural patterns. Give advice for patient-friendly right prescription. Now let's begin our new lesson. I want to begin my lesson with warming up, drilling activity for whole group. Now listen to me attentively, then you'll repeat after me. A healthy mind and a healthy body. Healthy is a happiness. Health is a great reach. There are no riches like health. Would you like to be healthy? Yes, of course. Now repeat after me. A healthy mind and a healthy body. Healthy is happiness. Health is a great reach. There are no riches like health. Would you like to be healthy? Yes, of course. Okay, let's begin our new lesson. Students, I'll introduce you with the names of disease and today's new words. I have given you a printed material with the names of disease and with the new words with the translation. Listen to me attentively and look for their translations. A sore throat, a bad cough, run a high temperature, have a bad cold, have a headache, heart disease, toothache, backache, earache, bad pain in the stomach, high and low blood pressure, sneezing and cough, measles, pneumonia, flu, scarlet fever. Now, is it clear for you? Now, let's introduce with the new words. Pay attention to the translation and listen to me attentively, please. Take your temperature, examine you, feel your pulse, sound your heart and lungs, have your chest x-rayed if necessary, prescribe you some treatment, pill, tablets, mixtures, or some other medicine. Test your blood pressure, isolate it and should drink a lot of hot tea, lemon, and honey. Now, is it clear for you the names of disease and the new words? Now, we use these words during our lesson. Now, next task is working on the text with GSCO. Now, I have divided you into two groups. The first group is disease, the second group is treatment. Now, let's introduce with a descriptor. With this task, a learner works in group, reads the text, finds out the necessary information, answers the questions using specific vocabulary, asks the group. Formative assessment, groups assessment. Students check each group according to the criteria. Based on the results, each group will receive mark. To the group disease, write 14 words and expressions. Lack of cooperation in time, few mistakes. To the group treatment, find the text English equivalent, cooperation work done in time, correct spelling. Now, let's begin reading our text. Now, let's work with the text, disease and their treatment. Now, first part of this text to the first group. I'll give you 2 minutes to read and translate. After that, you'll answer the questions. I'll give you 2 minutes. Have you read and translated the students? Okay, the next part is to the second group. I'll give you also 2 minutes to read and translate the text. Now, students, is it clear to you, this text? Now, be ready to answer the questions, please. Questions for the first group. First question. Kurkim, please answer. What do you usually do when you get sick? Right answer. You usually go to a doctor when you get sick. Now the second question to Uljan. Uljan, please. What are symptoms of the throat? Well done. Symptoms of the throat are sneezing and cough. The third question. Do you always follow the doctor's prescriptions? Alibek. Thank you. You always follow the doctor's prescriptions. The fourth question. Akhtoto, please. What are the most common childhood diseases? Good job. The most common childhood disease are measles, pneumonia, flu, scarlet fever, and sore throat. The last question, Janar, please. Do people like visiting a doctor? Yes, nobody likes visiting a doctor. Now questions to the second group, please. The first question. Dinara, what are the most serious diseases? You are right. The most serious diseases include heart attacks, asthma, multiple sclerosis, sepsis, and many others. The second question, answer please, Asal. What are the symptoms of flu? Good job. Your symptoms of flu, tonsillitis, measles, mumps, scarlet fever. Thank you. The third question, what do you do when you fall ill? Mariam? Thank you. When you fall sick, you make an appointment with a doctor, send for a doctor, or in most serious cases, call in ambulance. The next question. What does the doctor do when he comes to examine you, Adema? Thank you. When the doctor comes, he examines you and prescribes you some medicine. The last question. Who is treated at the polyclinics and who is treated at the hospital? Who answers? Ayjan? You are right. Specialist general practitioner is treated at the polyclinics, and a person who specializes in one area of medical treatment treated at the hospital. Our next task, activity 2, pair work. Descriptor. A learner works in pairs, reads the proverb, find out necessary information, consult the doctor, ask the partner. Formative assessments, peer assessment. Teacher hands out the evaluation cards to the learners. Every student assesses his or her partner according to their response. Excellent, well-formed sentence. The learner uses specific vocabulary correctly, can pronounce the words precisely. Good, well-formed sentence. The student uses new vocabulary, some pronunciation mistakes. Average, partly answer. The learner uses simple words. Poor, low answer, lack of vocabulary, bad pronunciation. Now, students, please. Now, give definition of the proverb, health is above wealth, make sentence. I'll give you a minute. Now, have you given the definition of the proverb? Please. Жанар and Adima, read please. Good job, very well. Now, consult a doctor, please, Janar. Consult Adima. Thank you, you are right. Now, activity 3, it is individual work. Teacher hands out the differentiated worksheets according to the level of the learners. A level, how to live a healthy lifestyle. If you want to be strong and healthy, what you should do, give your advice. Birgit, please. Now, thank you. The last is early to bed and early to rise make a man healthy, wealthy, and wise. Thank you, Birgit. Take a seat. Now, next is B-level students. The task is match the names of the disease with the names of medicine. For example, I'll ask questions, you will answer to my questions. The first question, what should I take for my headache? Adima, please. Very well. You are right. I should take for my headache aspirin. Now the next task is, Alibek, answer please. Good job. The next, Janar. Thank you. Mariam. Well done. Asıl. Very well. Biriket. Thank you. Now students, next is C level. Use the words to make sentence. The following words: headache, toothache, sore throat, stomachache, pain in the knee. Pamela ate too much ice cream yesterday and today she has got a sore throat. The next is Dinara. Thank you, pain in the knee. The third sentence, Ayjan, stomachache. Then didn't wash his hands before supper yesterday and today she has got a stomachache. Every person must wash their hands before eating. The last is Amanda often has got a headache because she watches TV from morning till night. Friend doesn't visit dentist regularly, that's why he often has got a toothache. You must go to the dentist. Thank you. Now students, I have given you the table with the learners' criteria, spelling mistakes, how we have spelled grammatical and completion, A level, B level, C level. And I have given you the score 90, the score 80, the definition and the score of 75. Now reflection time, student. I'll give you reflection cards, you'll complete it and return me, please. Now students, I'll give you mark. Students, you were active today. I like your answer. I'll give you excellent mark for you. And your home task will be the first to learn by heart the new words, to make up sentence with the new words, and make up dialogue to the theme visiting a doctor. Now students, the lesson is over. Goodbye.